Hi, I've been asked many times about the different technique in breast augmentations. Ever since the 1960s, when the silicone breast implant was first invented, it has become the most popular technique in breast augmentations. Over the last 60 years, the quality of the implant has definitely improved. It is now known to be the sixth generations, and be it the shells of the implant or the contents have all improved to help to reduce the risk of complication and improve the feel of the implant. An alternative is using saline implant, but it is probably less popular overall. This may be related to the fact that saline implant, if it's overfilled, will feel a lot heavier and harder, and an underfilled implant will produce a more rippling effect. Breast implants come in different size, shapes, and projections. The size of increment per operation is dependent on the skin tone, the footprint of the breast, the volume of tissue covering, and the shape of the patients. Obviously, the most important thing is the patient wishes, but this is why consultation is very important. However, we always recommend the fact that be careful of excessive enlargement of the breast. This will create a very fake look. It may increase the palpability of the implant, increase lateral projections, and sometimes medial coverage, leading to what we know as symastia. Breast implant itself is not without complications. It itself is a man-made substance and therefore do have its lifespan. The two most common problems are ruptures and capsular contracture. On average, we will recommend the implant to be exchanged every 10 years or so. Most patients can have the implant for longer, but some do have it for a shorter period of time. Recently, anaplastic large cell lymphoma and breast implant illnesses has become more well known. Even though they're still relatively uncommon, some patients has decided that implant is not what they want to go through with. An alternative option to breast implant augmentations would be to use your own fatty tissue for augmentation. This is known as fat transfer or lipomodeling. In liposuctions, where we remove excess fat from other parts of your body like the abdomen, the back, and the thigh. Usually they're discarded, but in the case of fat transfer or lipomodeling, these fats are collected into a container, washed and cleaned, and then can be re-injected into the breast to increase the volume.